Good afternoon, everyone, and thank you for joining us here on this chilly Friday. It is Samurai 50, and here on the platform, we like to bring you inspiring individuals, successful individuals of all types of businesses, all types of people, and people. Our intent really is to deliver information to you that inspires you and lets you know that we're all go through these challenges in our journeys as entrepreneurs, no matter what that looks like for you. So I'm really excited to bring this guest on our platform today because this is going to be a different type of entrepreneur than we've had on the show in the past. So I've had a great chat with Dr. Zaidi, who is here with us today. And Dr. Zaidi is the owner of Signature Medical Clinic. And I have a long list of things to read here, and I don't want to get them wrong. So I'm actually going to read from my notes here. Dr. Zaidi also teaches medicine at the University of Calgary, has served as a health policy advisor, extremely passionate and dedicated to his patients. And I sure learned this yesterday in our chat, to really fostering, positive change and helping to ensure that he's making a difference and making the world a better place. And that probably, Dr. Zaidi, was my favorite thing I learned from you in everything we talked about yesterday. So he's also a clinical assistant professor at the Department of Family Medicine, Cummings School of Medicine, University of Calgary, and of course, the CEO and medical director for Signature Health 360. So welcome. Thank you so much for joining us. That is a long list of accolades, and I know that's not even all of them.
Thank you very much for the kind words.
Yeah, so it's really great to have your perspective at this time. It would be great to have your perspective at any time. But what we're all dealing with now, there's lots of things people are, unsure of, uncertain of, and I know that some of the questions I'm going to ask that you'll answer and sort of clear some of that up for us. So why don't we start at the beginning? And I'm not talking about the beginning of your life, but the beginning of your journey. Or why don't you just tell us a little bit about you?
So I was born in Pakistan, Karachi, and my parents moved to Canada in the early 70s. After a few years, my parents went back to Pakistan. I finished my medical school from Dow Medical College. After that, I moved to Canada. I did my MSc in epidemiology from University of Toronto. Then later went to Ottawa, did my graduate degree in population health assessment and management, and I got residency at Northern School of Medicine. Did my family medicine residency over there. And then I moved to Calgary to start my family practice here, and I'm here for the last 8 years.
8 years. Okay, so you're a true Calgarian now. I think 8 years qualifies for you to be a
Very
true.
Yeah.
So, what brought you west when you had so much time spent in the east? What brought you west specifically?
So when I started practicing family medicine in Ontario, the model is one complaint per visit. So because the way they bill and the way the doctors can bill, it's one appointment is one complaint. If you deal with more complaints, then it's difficult to pay your bills. So the model there is one complaint per visit. And I didn't just find that it's proper way of doing family medicine. If the person comes in, you cannot say that, oh, we'll talk about your asthma today, but not diabetes, or diabetes today, but not your depression. And I won't check your blood pressure. It's just not the right way of doing medicine. So in Alberta, the way the family medicine worked before, things are changing as we speak, that they were, after you spend 15 minutes with a patient, you can add a modifier. So you can bill appropriately for your time. So that to me felt that it's a proper way of doing family medicine, in which a patient comes in, they can come and talk about their asthma, diabetes, high blood pressure, and how their family is doing, and also their parents' health. So to me, it felt like this is a proper way of addressing family medicine and doing it in the right way. That's why I moved to West.
Moved west. Okay. And I can certainly see that being a big part, a big reason. Boy, that would be challenging on the patients and on your end to be only to deal with one matter at a time. So, I mean, that makes a lot of sense. So, Dr. Zaidi, why did you decide to open your own clinic versus, just working somewhere else?
So I worked at multiple clinics before opening my own, and one of the biggest things I saw is that the way patients were treated in medical clinics were not the best way of how you would provide care. If you go to the dentist office or any private clinic, the the staff smiles at you, you're
Mm.
properly taken care of. Whereas as the family practice clinics, you are just a number. And they'll say, John, have a seat, right? And John, come in, room one. And there wasn't an element of being human and having it personal. So I felt that it was missing. And another clinic, my patient was sitting out there for half an hour. I had to go to staff and say, my patient is sitting out there. I said, no, your patient is not here. I'm like, no, that is my patient. They called, oh, forgot to enter. So the patient was not even registered that they arrived, or they would be sitting out and my rooms would be empty. And the way they were treated was not the way I wanted my patients to be treated.
Yeah.
So that was one of the biggest elements and the reason why we opened our clinic. And at Signature Medical Center, you will find that the staff would treat you in a better way. When people come to the clinic, they go, hey, how are you doing? Good afternoon. How's the weather? Or how are you doing? Make them see, tell them approximately what the wait time is. And as soon as the room is available, it's properly cleaned, and the staff will put the patient in there, telling how much time approximately. If I'm doing a physical, it's 10 minutes or 15 minutes, or if I'm just finishing off, they'll tell be here in 10 minutes or 5 minutes.
Mm-hmm.
So in this way, patients are treated better. We are able to send a text message to the patients that a day before that your appointment is tomorrow at this time. Patients are called back within a day or within the same day if we have their blood work. So it's more efficient, effective, and in a compassionate way of treating patients.
Mm-hmm. Which was very, very important to you. So it's nice that you were able to create that for yourself. So in creating a business, your own clinic, you knew what you were doing on the medical side. And then on the business side, you have been a StyleLabs client now for quite some time. And so let's talk about how important that has been for you. How important was marketing in the success that you're experiencing today?
So in the other clinics I worked, some of the clinics did not even have a website.
Mm-hmm.
And there was no marketing or incredibly poor marketing done. So to me, it was most important to have a proper way of telling people of what we are doing and who we are. And so I knew 𝐼𝐿𝐿 from before, and we had chatted about his business, his philosophy of working, and his professionalism. So before starting the business, I went to 𝐼𝐿𝐿 and said, you know what, I'm starting this. You're going to develop the website. This is my business vision. This is the business model. That's what we're going to do.
Mm-hmm.
So he gave me a path forward. He and his team developed the website, which when I show to my patients who are in IT, they say it's incredible. Because of his marketing, we started at around 15 to 25 patients a day. And within 2 years, we are at 100 patients a day at the clinic. And with his marketing strategy, we are just not taking patients from our catchment area, but because of the client and kind of people comment and their recommendations, we are receiving patients from broader Calgary as well.
Mm-hmm, mm-hmm. Love to hear that. And it's common that people that plug into the systems, the marketing that we provide, and the ecosystem, the digital ecosystem that we provide here at StyleLabs, that you're able to create, connect all those dots and essentially grow at that rate. So from 15 to 20 clients all the way up to 100, that's a completely different business.
True.
With that volume. Yeah. And you certainly understand the value, and you have done the work to get there as well. So, I know that we did your website, we had the CRM, Google reviews, ads, and social. I mean, you're on social media.
Yes, that's true.
Yeah. And here you are today again on social media. So like I say, all of those dots that are connected through our ecosystems really help propel businesses forward and create additional revenue, additional income. So you're certainly a case study that the system works, our systems work, and we're really happy that, and I like that you said too, that your visitors are not just, small geographical close to you is what I'm getting at.
Yeah.
They are coming from all over because of your digital footprint.
Yeah.
Yeah.
True.
So it's wonderful. And I'm glad that you're experiencing that success. And we look forward, of course, to helping grow that even more. And I know there's some plans in the development that we'll maybe talk about later. So how much, what happened with your clinic when COVID hit, and how did COVID impact you?
So to say, we live in a very unprecedented time where we are today. So, but luckily, we didn't stop seeing patients or caring for patients for a single day. During the first shutdown, the clinic closed door to the patients, but we went virtual. I think just not myself, but every other clinic has spent thousands of dollars and to upgrade themselves. We with StyleLabs launched a whole telecom, a whole telemedicine platform, which is on our website to care provide for our patients. We put screens. All the staff have to wear masks and shields now. The room were clean before, but now it's a comprehensive cleaning after every patient. Our staff rooms are, the waiting room used to have 12 or 15 patients at a time. Now there could be only 5 patients, the rest will sit in the car. So we have adopted to the times, but to say the least, the business took a hit from some 40 to 80%. But one of the time we had to let our half of the staff go when we were doing virtual care. But slowly things have come back. So now we are 50-50 with virtual care and in-person care. So we have opened the doors for our patients to come in. And so we are trying to do both. So to manage properly, just not myself, I think every other physician in town has invested their time and money and to provide care for their patients. But the irony of the matter is that the way we have been compensated by the government has significantly decreased. The billings which TELUS is getting is double than what we are paid for the same time. So it's unfortunate, it's heartbreaking that we are taking the loss but providing care. But you know what, to say the least, we are still very fortunate that our doors are open to provide care for the patient. We work every day to do that, and we are doing the best we can during these times.
That is so interesting, and I think that people don't realize, because as patients and as the community, as the public, we're going through all of these things, and we sort of don't look at a business such as yours having the same struggles, the same struggles, but on a different level with your business. And you didn't close for a day, which is really, really impressive. Many people did. And you were able to already have that presence online and have that system, that process to be able to switch very, very quickly to telemedicine. And I mean, I think you can answer this, but is telemedicine here to stay?
So it has its pros and cons, and I think it's here to stay now. So the pros are that if somebody did an X-ray and I want to just tell them about the results, so they don't really need to come in to hear that, right? Or the blood work was done and I'm telling them they have high or low cholesterol and this is what they need to do. So that's fine. But now refilling the medication, not able to do the blood pressure, refilling their depression medication, not able to see the effects on the face, because patients can come in and say, I'm doing fine, but have this the effect that they're not well and they're not looking at you. Then you can probe that a little more. So is everything okay? And then they go, no, I have stress at work. And then you get into it. But so refilling over the phone does not give the same rigor of the clinical attention that we are used to. So refilling is not the best thing to do. Like per se, just a medication it's like a cholesterol medication to be refilled. I can see the blood work and refill the medication. But for depression, anxiety, for other forms, I'm not too comfortable doing it. But during this time, we are doing it. But and again, over the phone, I kind of have a good sense of humor, so I kind of joke with my patients. So once I make a joke, I just have to, if there's silence on the other side, I have to say, you get the joke. That was a joke, right? Yeah, I know, I get that. I'm like, so it's so difficult that, having a sense of humor or kind of saying the same thing, but not able to see the face of the patient.
Sure.
It's really difficult. And I think my patients are finding it difficult as well, because they want to be in the clinic and kind of have their human interaction.
Yes.
So telemedicine would stay, but I think if the billing code and the compensation should be appropriate, because the time we spend over the phone, we can just type everything. So we are typing the stuff for another 5 or 7 minutes, but not compensated for that. And it's time, and eventually, at the end of the day, we have to pay our bills as well and pay the salaries for the staff as well. So that needs to be fixed. But so there is an element, and there's benefit of telemedicine in the future, but it has to be a small part of it.
Right. No, that makes perfect sense. And perhaps when we start to come out of this on the other end, whenever that is, you'll start to see more people coming back in for exactly that. So you can, have the conversation, the personalization, read the body language, and sort of get more to the root of something more so than person is able to share on the phone. So I can see that being a challenge for sure. So, what other challenges are patients facing right now, and what should they be doing?
So uncertainty.
Hmm.
The government messages are not clear, and they keep on changing. And I understand things do change, but
Hmm.
the premier not allowing people to wear masks for the longest time in the rural areas just create this dichotomy: should we wear a mask or should we not wear a mask? Whereas public health was very clear from the very beginning that we should wear a mask, clean our hands. So if we leave the political side of the matters and keep things straight for public health and allow public health to lead public health and not the political side, I think we can do better. So, one thing we need to be very clear of that in these times, the most important thing is not to socialize, right?
Hmm.
Keep the socializing to the minimum possible. Maintain a good, safe social distance of 6 feet. Wear a mask, and now the new recommendations is to wear a double mask, right?
Hmm.
Or a mask and a face shield, which we do in our clinic, and sanitize your hands
Yeah.
all the time. It's like if you don't touch your face, eyes, or mouth without cleaning your hands. And I think these are the ways we can prevent the spread and keep ourselves and our loved ones safe.
Yeah. Completely agree with you. And those are things that are in our control. We can do them, however frustrating they are. And yes, it's going on for a long, long time, but let's all do our part to mitigate and to sort of, like you say, stop the spread. So let's talk about the vaccine.
Mhm.
Should people be getting the vaccine? What's your position on that?
So you know what? Anytime people have to put anything in their body, they're uncomfortable.
Hmm.
People take the medication not knowing because they trust their family doctor or the doctor they went to, and that they know that they will be doing something in their best interest. Medications and vaccines are developed over several years. The human testing safeguards are in place. They do the studies, but during this time, everything is speeded up. We still had a human testing done. We still are looking at the recommendations, the side effects, and everything else. So, with a lot of spread of misinformation, people are very uncomfortable should or not they take the medication. But I
Hmm.
think because I think we are fortunate to be in Canada that our FDA or Health Canada would not approve anything which is not appropriately scientifically based, and kind of they have gone through the best human possible way to see how the benefits outweigh the harm. And that's what the basic principle of medicine is. And I think at this point we all agree that what the vaccines that are available that have been approved and that have been administered is the best way of going forward.
Hmm.
So, with being as uncomfortable and as uncertain we are, I think we should trust our government with the fact that they are doing the best they can, and these vaccines are the best way of preventing uh, the spread of the disease. And now we know after the new studies have come out that even with people had the vaccination done, there are outbreaks of the disease happening. But because of the vaccination, the morbidity and mortality has decreased. The severity of illness has decreased in elderly population. So I think it's a positive way of looking at it.
Yeah.
The best way would have been that there was no outbreak after having the vaccine, but at least the vaccine has decreased the morbidity and mortality in the elderly population that we know of. So, you know what? I haven't been offered a vaccine yet, but the day I've been offered, I will take the vaccine, and I will
Yeah.
recommend everybody to do the same. If
Yeah.
some people have comorbidities or allergies to certain products, they should call 811 or public health or their family doctor to know whether they are a good candidate for the vaccine or not.
Right, right. And one really important thing, everything you said there was really important. And I hope that people are really going to listen to the detail that you explained there. One of the things you noted is that, yes, we are so fortunate that we are in Canada. And, the FDA here is among the strictest there is. So I agree. I think that we need to recognize that here in this case, as we do with so many other things that the FDA approves or disapproves. That's a very important piece of information that you noted there. So what do you think, and I'm with you, as soon as it's available, my
Mhm.
mom, I'm taking my mom first, and
Yeah.
then I'll be lining up right behind her. So I'm with you on that. So what do you think is next? And I know you don't have a crystal ball, none of us do, but what do you think is next with the pandemic? What's going to happen?
So we have a shortage of vaccines in Canada and everywhere else as well. Some populations have been properly vaccinated, but in Canada, we don't have the vaccine at this point. And we have authorized our local production as well. So the hope is that when at least 80% of the population is vaccinated, especially the elderly, the people who have comorbidities or mortalities, once that population is vaccinated, people above 30 are vaccinated, or people younger who have comorbidities, then we have inherent immunity or herd immunity among the population. So before going to 100%, we can at least open the economy a little more,
Sure.
and start socializing a little more, and kind of life can return back to a little bit towards normal,
Mhm.
and things can return back to where they were before, once 80%, 90% population is vaccinated. But
Mhm.
the hope is there. We have vaccines in Canada that have started the production. So I hope that in time, not in the next few months, but over the next 6 to 8 months or 10 months, we will see that the more population is being vaccinated, so we can get back to normal.
Yeah. No, that's so good to hear, your perspective on that. And it is, there is a light at the end of this tunnel. And I know it's
True.
been a long, long, long road, and sort of, we thought we were there and then we weren't, and then we thought we were getting there and then we weren't. But, as you say, all of the mechanisms and the processes are in place to look towards that becoming a reality in the next, like, 6, 8, 10 months. So
Yeah.
we can do it. We can do it. We've done it already for
True.
longer than that. So
Just
we
have
can
to be patient.
be patient,
Yeah.
and all of the things that you mentioned that we should still continue to do to keep ourselves and our loved ones and our community and our city safe. So what this is just kind of a general question, for you as as in your practice, and what's next for you? What's next for Dr. Zaidi?
So when we opened the clinic, we had conversations with multiple people to have Signature Health 360, which you talked about, and it hasn't come to fruition because my accountant and everybody told me that let's do one business properly first. So now Signature Medical Center is running well. We have 3 doctors at the clinic, multiple staff over here, and then things are running in a way that we envision. So things are coming along. We would like to have more physicians at the clinic, but that's next to come. But one thing which I'm really passionate about is providing senior care, and allowing senior to stay in their own house for a longer time, as long as we can. And we know that if we're not living in the previous models that 3 generations of the same family live in the house, we know that children, as soon as they find opportunities to go for education or work, they leave the house, and so the parents are left alone. Our wish is that we can provide that care that they deserve and in their house. So I'm working with multiple other multidisciplinary teams so that we can have a system in which we provide medical care, allied medical care, home care in the house, with everything is connected, and it's an MD-based model, so that how people still are getting that same care, but it's fragmented, and one part doesn't talk to the other. In this vision that we have, and we spoke to Almin as well about it, is that we provide that comprehensive care in a way that the children sitting in Toronto or Arizona or Africa can just call one number, and then one caseworker can tell, yeah, your father's dermatologist appointment is next week. He saw the GI specialist, and that's what happened. They got the massage therapy done last week. The next session is next month. The medications are done. Home care services, we go there. They play chess twice a week. They take them for walks. The food service are providing this food. They're getting all the different components of their diet. They're doing well. They had a physical with the family physician last week, and it's coming along well. So that one phone call instead of calling so many different people. So that's the vision that we can keep seniors in their house as long as we can and provide all uh, the support they need in their house and have a conversation with their loved ones to provide the detail of how
Sure.
we are providing care to them.
Wow. That sounds incredible. And I look forward to hearing more about that. There is a big need for that. I can see that being very, very successful. So I look forward to hearing more on that. So we're going to wrap it up, Dr. Zaidi. And when that happens, whenever that is, of course, we'd love to have you come back on, and then we can talk, a little bit more about how that rolled out and how that whole thing takes off and evolves. So as we sign off here, where is the best place for people to reach you?
Signature Medical Center at our website.
Which is signaturemedicalcenter.ca.
I think it's signaturemedical.ca. Yeah.
Yeah, it is. So we put the link down below as well. So if someone needs to just go in the comments, we'll put the link down below. And I know you have a busy day. Every day at your clinic is super busy. So I thank you so much for joining us today and sharing really your insight and your valuable knowledge and your opinions on what we're all dealing with here today. So thank you so much.
And thank you for having me.
All right. Well, you have yourself a good rest of your day. And thanks, everybody. And we'll see you next week, Friday.
Okay. Take care.